Hi everyone, welcome to 1 p.m. Just a reminder that you're listening to the summary version of this discussion. We present the first principles of the condition so that you can derive the clinical features and management.
So shock is where we have a lack of oxygen and perfusion to tissues, either a result of increased demand, inadequate perfusion, and increased utilization.
Unable to utilize that
Oh,
oxygen
right.
or whatever.
Okay.
Right?
Yeah.
Or essentially
Yeah.
metabolic
Yeah.
demands.
Shock can be classified into stages, a spectrum. So we've got pre-shock, where it's mainly compensated. So they might just have a mild tachycardia. And then you've got shock itself, where they teeter into decompensated. And then you've got sort of aftershock.
God damn, that's good. That sounds
Post-shock.
so much cooler, man. My patient just went to aftershock now.
Yeah. And organ damage.
Yeah, organ damage, right? Okay, great. So shock, as Nick summarized fairly well there, can actually be broken down into 5 main types, okay? By understanding these 5 types, I think it helps you understand the management of the different types of shock, okay? So does anyone want to go through all the 5 types of shock and give me a quick summary definition for each one?
All right. So I'll start off with the heart because it's all those intracardiac causes. And then I'll go outside of the heart. So the extracardiac would be the obstructive causes of shock. And then I'm thinking about the things before the heart. So pre-heart, I'm going to classify as hypovolemic shock. And then the last one is sepsis, inflammation, distributive shock, because it's after the heart, right?
I haven't thought about it
Whatever.
that way,
Yeah.
but you know what?
Yeah,
It's
it's
not
a
a bad
good way
way.
to think about it. Like,
And you forgot the most important one, bro.
Come on, man.
Combined shock, eh?
Cop out,
Combined
hands
shock.
up.
So Nick, can you give me a little summary of that, of those examination
Yeah, sure.
signs?
So the examination signs, there are 3 key examination signs to help you distinguish between the 5 types of shock. And these include peripheries, so feeling whether they're warm or cool, JVP, and lung sounds. Now, if the peripheries are warm, you can be quite confident that it's a distributed type of shock. And with cold peripheries, you can take further steps with looking at their JVP. And if the JVP is low with cool peripheries, it's going to be hypovolemic. And if you have raised JVP and cool peripheries, it can either be obstructive or cardiogenic. And that's where you listen to the lungs. So if you listen to lungs and you hear crackles and you think this may be APO, you're going to lean towards cardiogenic. And if they're normal or reduced, you can probably lean towards obstructive.
Now let's get back to the case, right? The patient's peripheries are warm to touch with a low JVP, and you notice their IV cannula side is red and looking infected. You are now confident that the patient is suffering from a distributive shock caused by sepsis. How would you manage this?
I'd call for help.
Yeah. But we want to treat the underlying cause of the shock. And as you all know, and as avid listeners of the show, we have gone through sepsis, right? We have gone through the sepsis 6, okay? Nick,
Yeah.
have you fucking listened to our show, man? This is the best.
I have, man.
The
I have. I'm a
sepsis
loyal
6,
listener.
man.
I'm
Hey.
the 1 p.m. podcast listener.
And I want to break it down. There are 3 in
Yeah,
and 3
3
out.
out,
So
yeah.
you do the 3 in, and we get Jade to do the 3 out to
Yeah.
see whether they fucking listens. Okay?
All right. So sepsis 6. So 3 in is oxygen, and then IV line, you want to give them fluids and antibiotics.
Brilliant, Nick.
Yeah.
I'm so impressed, man.
Thanks,
Such an
man.
avid listener of the
I
show.
listen so much.
Okay, now Jay, you were on this episode, man.
So,
Standards are high.
3 out blood cultures, VBG, and catheter for fluid balance. Urine output, basically.
Great. So blood cultures, BBG, and urine output and vital signs reassess. So for shock, right? The 3 key steps, you've done a thorough A to E assessment. You've established the likely cause of the shock, and then you've treated the underlying cause of the shock. Okay, so the 5 key takeaways. Shock is a life-threatening state of cellular and tissue hypoxia due to either and or a combination of reduced oxygen delivery, increased oxygen consumption, or inadequate oxygen utilization. And shock must be recognized and treated early to prevent progression to irreversible organ dysfunction. And as we know, shock is categorized into 5 different types, which include distributive, cardiogenic, hypovolemic, obstructive, and combined. And when you're examining a patient in shock, the different types of shock can be differentiated based on their peripheral temperature, their JVP, and their breath sounds. And finally, Once a patient is stabilized with an AT assessment, the underlying cause of shock must be investigated and treated. So those are 5 simple key takeaways. Okay. Thank you for listening to our episode this week on 1pm. To get the most out of this podcast, we recommend checking out our Notion document on the topic, which includes our Anki cards, as well as previous topics we've covered, such as heart failure, asthma, and DKA.